Hello, lab experts. Welcome to the RoK Diagnostics podcast. In today's episode, we'll be having a discussion with Hugues Lokossa, a specialist in supply chain management, and we're going to discuss healthcare in Africa and how supply chain management can be a very important addendum, can be a very important specialty to ensure that all of our health systems function efficiently and at the best of their capacity. So, Hugues, how are you today?
Good. How are you?
I'm very good. So, supply chain management and how it's important to the healthcare sector. Some people, even myself, I'm not sure I really know what supply chain management is. So, can you give us a quick overview of what exactly it is?
Well, yes. Supply chain will be, if I have to put it very simply, it's every single thing that you put in place to make sure you have one product that goes from point A to point D in a certain period of time, like a very limited period of time, so you can get there on time and in really good conditions.
Okay.
So that's exactly what it is. So when we are talking about the health sector, we're thinking more about health products like medicines and all that kind of stuff.
Yeah. And so medicines, so that's more towards the hospitals, but then I'm sure it's also important in the whole of healthcare. So even in the lab sector, I think it will be very important. Apart from, so it means that it allows you to make sure that a given product that you have is sent exactly where it's needed at the time that it's needed. Now, in our countries, yes, you were saying?
Yeah, no, I was just gonna add also the same product will have to be kept in really good conditions.
Yes. Yeah. So in our countries, it seems like we have, well, apart from the planning, it seems like we really have two big problems from what I'm seeing. Keeping it in good condition and also transport. So one of the things also is the time that it takes to get from one place to the other. So what are some ways that are used to ensure that the product that is important, that's needed at one place at a particular time, how do we ensure that it actually gets there?
Well, we don't have only two challenges, we have many challenges. The best supply chain is like a mix of two options. Okay, it's like a mix of it's like mixing two different options. The first one is, since we're talking about health products, you have to make sure you know what's supposed to be done to handle a health product. Because you don't just handle a health product like you would handle like food and stuff like that. So that's the first part. The second one, you have to think like a really local person, because whether you like it or not, bottles of Coca-Cola, they get everywhere. Even if the condition of the roads are really bad, even if it's raining, you go to the furthest village in any country, there is a good chance you will see at least one bottle there.
Yes.
And if there is one bottle of Coca-Cola in that place, it means that there is a way for your goods or for your commodities to get there. So now the challenge will be being able to put together those two options and still deliver at a pretty competitive price. And that's where it's kind of complicated.
Yeah.
Because you have some supply chain experts who will be like, I don't really want to take the chance of getting my product there in bad conditions just because I want a good price. So I'd rather pay the best of the best to get commodities to the place, which is really good, but also really expensive.
Yeah.
You have some other supply chains who are more like, yeah, Even if it's a health product, it's just a product before being a health product. So I'm more into taking the risk of using the local system to deliver my commodity. And those two sides keep fighting 24/7. We don't know yet who's going to win, but for sure, the answer is neither on the complete right side, because it is not sustainable. There is no African government who's going to be able of following up a project like that. And the guy who is also on the complete left side is not right too, because maybe there is too much risk in handling certain products like vaccines or laboratory projects, that you have to keep in a certain degrees of Fahrenheit. So that's how I see it. It's a beautiful game. It's a complicated game. It is beautiful, and that's why we love it.
Yeah. Now, you use one very interesting sentence. Like you said, you have to think, in order to get the products to where you want to, you have to think like a local person. How do you do that? How do you put yourself in the position of someone like in a remote area to try and think through the way he can access the products? Do you actually go there?
Well, yes. One of the things that we supply chain specialists we like is going in the field, because even if you've studied the environment on your computer, you only know what you're facing if you have done the whole thing yourself. So usually what we advise or what we do is you go to the last mile by yourself. You take the car, you take the boat, you ride on the bike, you ride on the bicycle, or sometimes you just walk the place to get a sense of what is needed. It's true that with experience, you don't really need to do it every single time, because if you've done it once or twice, at least you know what you're expecting. But it has to be done so you can think like a local person. I know sometimes it takes it takes time. Like if you work in places like DRC or in certain places in certain countries, just to get a glimpse of what they're facing, you might be going on the field for no less than 3 months, because you have to speak to people, you have to understand what they're going through, you have to do it yourself, you have to sleep at night in places that you might be afraid of. But it's good because at least you know what you're expecting. But of course, you have to be alive, so you don't go to places where you might get killed, or so there is a limit to the risk you're going to take. But for the sake of the proposal or the answer you're going to provide for this challenge, it's important that you go there and you understand how things are going.
Yeah. And when you're in the field, I think I wanted to ask you a question, but I think you answered it when you say that you have to go in the field and then stay for like 3 months in order to know how the people live. Because the question I was going to answer was, how are you sure that the people you are talking to are the people that can actually give you the correct answers? Because it depends. In some cases, you may go to someone, he may tell you one thing. I mean, it may not be true, right? It's like when you go and you buy a house, let's say somewhere in town, and you went during the dry season, and so everything was fine, and then you buy the house, and then you find out that the rainy season it's flooded everywhere, and then you can't do anything anymore.
No, the answer to that is to go in those places undercover. You don't go into the place being like, oh, I work for United Nations, or I work for USAID, or I work for this company, and I'm trying to find out how difficult it is for you guys to get commodities here. If you do that, you might not get the answer.
Yeah.
So you have to go undercover, like you have to go like a normal person, like you're going there just for visiting or for understanding, or you just taking the package yourself, or you're sending a package there. There are many ways to do it, but it has to be somehow undercover. Then you get information from people who are not interested in who you are as a person or what you bring in. They're just sending information to you so you can get a good idea of what you're expecting.
Yeah.
You also have to go there when they're facing challenges. So you don't go there in dry seasons. You just go there in rainy seasons if the type of challenge they're facing is being faced during the rainy season. You might have the complete opposite, like sometimes you can go to a certain village only when they're in the rainy season because the boat can be used. But if you guys are in the dry season, you just have to wait until they get more water to get there. So it depends on the kind of challenges they have.
Yeah. And so listening to this sounds like quite an interesting job. How did you get into it? What pushed you to this?
Yeah, that's a good question. I even didn't start with health products. I first started with buildings. I worked for a project back home. It was a project financed back home, I mean Benin. It was a project funded by World Bank, and it was aiming at building schools to increase the literacy among young children or something like that. And I was in charge of one of the projects to build schools in flooded areas in Benin, like Gambier City or stuff like that. And it was very interesting because the first challenge you face is how do you get the raw materials to the site on the other side of the land, and how do you get them in one piece. So it was quite difficult because when you buy cement and you have to transport it and you have water on it, then you're definitely gonna lose some. So we have to think about ways to reduce the purchasing price to make sure what we are losing during the transportation is actually matching what we are gaining when we're buying in bulk.
Yeah.
So it was interesting to organize all those sites that way. That's where I came across supply chain management, and I kind of loved it. And that's how I started. So my second project was a project funded by the President Malaria Initiative. At the time, I think it was Barack Obama. And the project was called Africa Indoors Residual Spraying. It was a project for fighting malaria using spray product in the north of Benin. So yeah, that's how I got into health supply chain management, and I've been there since.
Yeah. And something else that you said that I found interesting, that will be interesting to my general audience of medical laboratory scientists, is you also said that you have to think about how to go about reducing the prices so that the price at the level that is that allows you to actually do your work the way it's supposed to be done. And so there are many in this field that, I guess in lots of fields, that feel like in some cases when they're going to get some of the products they need, it's very expensive. How do you go about convincing like the people that you have to buy things from to get back to a level? Like what are some strategies that could be used to get someone back to a level that's going to allow you to be able to do what is necessary for your operation, your projects to keep thriving?
The thing with health products, when I think about Benin, is that Benin is a small country. So when a small country is ordering commodities, sellers don't see Benin as a really big challenge. So it's kind of difficult for a country like Benin to negotiate prices, whether they're buying in huge quantity or not. So it would be good if it was possible for us to purchase in bulk for many countries, for example. Like if I am to buy a product for HIV, it'll be interesting if I was able to buy it for like the whole of West Africa as one. Then I'm pretty sure you'll be able to get the price to go a little bit down. But it's kind of difficult for Benin. It's easier for countries like DRC because this country is huge. Like Kinshasa only has more population than all of Benin itself. So we're not talking about the same the same
Yeah.
options. Nevertheless, I know that sellers also are really inclined to decrease their prices when the country is well organized. So
Okay.
if you order on time, if you pay on time, if you have a really good supply chain system, then you might get also some nice prices. But that also is a challenge for us because since we are not the ones that are providing financially, or since we are still fighting for having some good data, like some quality data to be able to quantify the product we are supposed to purchase. There's still challenges for us to meet that end. And sometimes when it's time to negotiate the price, we're just not ready.
Yeah.
So I think before we get there, we need to work on certain aspect of our supply chain first, and then it will be possible to go there.
Do you mean?
But the other way to look at it is to have like local industries that can purchase or that can manufacture, certain products. But for that one, you need a leadership at the government or central level, which is a bit difficult because you know the pharmaceutical industry is a bit, I'm sorry to use the word, but when it comes down to money, they know how to make it work, you know. So
Yeah.
it's kind of hard, but if we're able to do that, I'm pretty sure we'll have pretty good prices for certain products.
I think there are some people who are watching this that are in the healthcare sector, or more specifically, even in the medical lab sector, and would like to help a little bit more. Let's say they already have a degree and maybe they are medical doctors or they are medical laboratory scientists, and they think they could help a bit, but they would like to learn more about supply chain management. What sort of avenues could they go through to learn more about this field?
Well, I'm thinking about 4 aspects of supply chain. I'm thinking about the healthcare supply chain. I'm thinking about the blockchain supply chain. I'm thinking about the logistics management. And there is a last one. It's called sustainable supply chain. So I think they have to look into those aspects. But the other thing is, I think we have a problem with free information. One of the challenges we have in Africa is financial challenges. Like we don't have the money to actually access the information. But the other thing is we don't even know that there are certain lots of information that are made available for free for us online. So for me, the first thing will be people need to know that the information is there and it's accessible and they should access it. And at the very early stage, like right when you're starting university, in your free time, you should be able to go into free resources online and learn. That's where you can learn the most. And people need also to put into programs, even if it's university programs, they need to make it mandatory that those free and accessible information have to be taken, like they have to be followed, and those courses have to be taken, and these young students have to learn about it. I think if we can do that, that'll be a really good incentives to learn more about supply chain without having to pay a dime.
Mm-hmm. Yeah, true.
Now, I'm not sure I answered your question.
Yes, you did, in the sense that you don't necessarily need to have to go and get a degree, but you can already start learning with information that is already found online. Yeah.
Exactly.
And actually, this point is interesting because that's one thing I think we are missing here, because in our universities, we aren't necessarily told that there is this information online. So there are some people that go to university and they are learning from material that's maybe like 20 years old from books, but
Yes.
they are not really up to date in many cases.
Yes.
And
Yes.
even
Yes.
worse in some cases. So for example, I did medical laboratory science, but one thing that is not taught to students here, like when they are in the field, is the laws that govern the field. So yes, you're told about what you have to do technically, but then the laws, you don't really know them in detail. So one general example, one problem that's we've seen here in Benin in like for the past, let's say about 5, 6 years, is labs were being closed because people that had the bachelor, that had the masters were opening laboratories. But then there's a 1996 law that says that you cannot open a lab if you have the bachelor's or you have the master's. But it's information that is never told to students when they are in school. And so they come out and then they see there are other people who have the bachelor, who have the master's, who opened labs. And so they think it's normal. They go and then they open the labs, right? But then eventually the government went back and then looked at the laws. And then according to the laws, you could not open a lab if you had a bachelor or a master. And so they started going around and then closing all those labs. And then people were, of course, it's their money, it's their livelihood. So they didn't know what to do, but it was the law, and the law has been there for more than 20 years. And so at the end of the day, it's like, it's always, there's a lack of information, like movement of information in some cases.
Yeah, I completely agree with you. And I think it has to do with how we train our students. You know, we don't train them completely, which is okay for me. But when you go to a school or a university, they should be able to tell you, okay, to be who you want to be, my university can provide you 50% of the information. But in addition to that, I can show you where you should be able to look for the rest.
Yeah.
So when you're having your bachelor or your master, know that you're good at what I taught you, but it's also good for you to know that you're not done yet. So when you want to start your project, make sure you get the information for the other 50% first.
Mm-hmm.
And that's where reading comes into place, because if you did not teach your students the love for reading, they're not used to looking for information, searching, and they get tired quickly. And they start, and I think that's where it's wrong, they start doing what they see other people do.
Yeah.
Instead of going to the information and do what they're supposed to. Oh, I saw this guy, he opened his lab and he's doing pretty good. You know nothing about how he opened the lab.
Exactly.
You just know that you guys went to school together. You don't know if he did some other degree after, or if he did something on the back. You don't know. And you're just doing what he is doing. And then you get into trouble.
Yeah.
It's an interesting fact, because I once participated in opening consulting firm. I was supposed to be an associate in the firm. In the end, I didn't, because I didn't have the money for it when everybody was ready. But it was interesting because there was, in this project, people from different nationalities. So the main question that came up front was, where actually do we put the head office of our consulting firm? And to have this answer, we had to go to look online for countries that had double tax treaty with every single country of each person in the board. And you had to read and read. It took like almost 1 year before we decided that we were going to this country, because there we still had some challenges, but it was challenges that could be overcome easily, you know. And it was interesting because on the way you learn things that you even didn't think about. You know, you have Benin don't have that double tax treaty with this other country. So if you ever put your firm in Benin, the guy who is from the other country will pay tax in Benin and will pay tax again in his country. And if it's 40%, then he's getting almost half of his money out just for taxes before he is getting taxed himself for revenue. So it's like a really big headache. But it was interesting, you know. And I loved the process. It was really long, but I loved the process, and it taught me that, you know, when you want to just, you know, run a project, it's not as easy as, okay, let's go, and on Monday morning everything is ready. It doesn't work that way.
Yeah.
Let's go means let's go find information. You have to ask. You have to challenge what you read. What if this happens? What do we do? We go for the information and we look for it. What if this happens? What do we do? And you guys, you just gather information. You ask people around. The worst that can happen is you don't open the thing.
Yeah.
But the best that can happen is you actually open it and you know what you're expecting.
I think when it comes to information, one thing that helped me is when I was studying in my group, I had a couple of people that I was close to that were used to doing some research online, and me myself, I was used to doing some research online. So I could clearly see the difference between what I was being taught and what I could actually find online. And I could see that the levels, like there was no comparison, like you couldn't even compare one to the other. And so quite quickly I understood that what I was being given there in class was just the beginning. It was just like the surface level. And then I had to supplement that with extra information. If not, by the time I came out, I wouldn't be competitive on the larger marketplace. Maybe on the national marketplace, but on the international marketplace, not at all. And so it's always important, I think. But that's where I think maybe the current governments in Africa are doing good these days, is they're trying to teach computer literacy a lot more early, which of course is helpful for the students because they can go online and then they can find out what is happening in other countries in the world and not just what they see around them in their own country. I think that's a nice direction to go.
Yeah, I'll give you an example. There is a link that sends you to this World Health Organization sites where you can actually learn some really good information and have certificates on cold supply chain management, like vaccines, supply chain management, which is interesting because I think it's something like 16 certificates and stuff like that. And it is so well done. It's the kind of link that I can actually send the link to you so you can put it, since it's a free resource, you can put it on the podcast. But it's something that I would actually give to every single supply chain student in Benin in his first year, you know, because for me, it's like valuable information. USAID has also free e-learning content that you can actually go and look for and have certificates that are as valuable as a university certificate, because these courses has been designed by doctors and really experienced supply chain experts, you know. So sometimes the information is there. If I have like a younger friend of mine who just got into supply chain, who is like, please, Hugues, I just saw this information. This company is doing some certificates and they said it costs this. And he's gonna ask you how well is the certificate known worldwide, and what do you think I should take it in addition to my master or stuff like that? And my first answer is always, okay, this is a list of free resources. Have you taken each and every one of them? If you haven't, that's where you should start. When you're done with all of the links that I've just sent you, then you will rethink about your question, and if you need, we can discuss about it. But I put it all the time on my WhatsApp status, but for me, it's not even enough because I don't see that it's been accessible enough to everyone. if I had the power, I would love to go to every single university in Benin and be like, this is the link for this training. I want you guys, please, before the end of the month, take it. Sometimes I even push pressure and I be like, I don't know if you have to pay for it, but I'm pretty sure if you fail, you're going to pay for it if you fail 2 or 3 times. Just to put the pressure on them so they can be like, I have to be careful about what I'm doing. And if not, I'm losing my option. And most of them get good results. So for me, it's really important.
Yeah.
I even have a bunch of young colleagues also who are into right now certified supply chain management programs. But what's interesting about what they're offering today is that they're offering courses that are important for the next level of supply chain.
Okay.
Like blockchain supply chain, like sustainable supply chain. Those are like new subjects for us. They're not new subjects in developed countries. They've been doing it for a while now, but those are new subjects for us. So I think it's also good because they looked for the information and they were like, I think this will be interesting for supply chain specialists in 5-10 years from now. Because Africa is like the next object or the next target for every big company. So for sure, 5-10 years from now, sustainable supply chain will be a big thing. Blockchain supply chain will be a big thing. So I really encouraged them to do it because I was like, that's well thought, actually. It's well thought. There should be more of this kind of innovation, you know.
This is the second time during the interview I'm hearing you talk about blockchain supply chain. What's that exactly? So last year, there was an event that was organized by a university in England. It was online. It was supposed to talk about the importance of blockchain to the healthcare system. I had signed up for it, but unfortunately on the day that it was taking place, I wasn't able to actually attend because I had some other things to do. But maybe you can help me and then give me like a small idea of what it's about. What's meant by blockchain supply chain?
Unfortunately, I'm not really an expert of blockchain supply chain, actually. I think what's interesting in blockchain, I will think of it as reducing complexity.
Okay.
Because blockchain provide access like to unified, to all actors along the chain to record, update, and view supply chain data. So it's a completely different way of running supply chain management. That's the only thing I understand about it because it kind of removes the need for intermediaries. I don't know if that's easier for you to understand. It's more like power is in the hands of the people who actually need the product, or who needs the information. There is no in-between partners that do something. And you can easily trace what you're doing because everything is done online. As good as it gets, that's what I can understand about blockchain. But it's in my intention to understand more of what blockchain supply chain is, so I can talk about it with you in some other podcasts when I'm ready.
All right. Okay, no problem. So in general, if you had, let's say, a word of advice for those in the healthcare system that would be interested in implementing or in better utilizing the services they have at hand, especially when it comes to this area, what would be your advice? Like, what's the biggest or the smallest thing you think they can change that's going to make the biggest change to the system and make things better?
Yeah, my advice will be capacity building. I am doing this study right now in Benin on exactly that question. Like the question is, what can we change in the system today that is free of costs, but that can bring a big change in reinforcing the quality of the supply chain in Benin, especially in the health sector?
Yeah.
And the answer is free online resources. You know, usually in the human resources for health sector, we usually look for funds with technical and financial partners to finance capacity reinforcement for us as in me being one of the human resources for health. But what we don't do enough is taking advantage of the free resources that are available. I think that if we do a really good work on looking for free online resources on supply chain management or any other sector related to health, and we just broadcast the information, or even better, we make it mandatory for every single human resources for health to take all those courses, I think it will be a good advantage for the system. And it's free.
Yeah.
How free is it? You have WhatsApp on your phone if you're working somewhere in Benin, so you are capable of accessing those free resources. You're waiting for your boss or for your government or for your company to pay those training for you. But in the end, I'm pretty sure that if you understand how important it is, you will spend less time on your status at night and more time accessing those free resources. And that will make you a better asset for your specialty. And there is a good chance that you might be so good that the private sector will actually hire you and pay you better.
Yeah, it happens.
You know?
Yeah.
So for me, if I have to propose a challenge today, it will be, let's go after those free resources. There are lots of them. Let's make it mandatory for all the human resources for health in Benin to take those courses. You know, then you'll have a good impact.
Yeah. So I feel what you're saying because, for example, I think it's last year, towards the middle/end of last year, that I started realizing that there is a lot of information for medical laboratory science that's free, that's online through organizations like the African Society for Laboratory Medicine or the World Health Organization. But the thing is, you have to look, in some cases, you have to look for specifically what it is before you're able to find it. So you can't just do a general search. You need to have a problem in mind and then do your search based on that problem that you have in mind, or you don't necessarily find it. So maybe also one thing that is important is for these organizations to also do a lot more communication, to also find out ways to better get in touch with the people that they are creating all these tools for. Because there are some very important tools, so some free tools that I was finding out you can actually use, let's say if you want your laboratory to be certified at an international level. And it's a step by, and on the World Health Organization website, what I was seeing for the medical sector, it's step by step. So each and every step, they tell you what you need to do. They tell you at this moment, you need this document. They have a sample of the document that you can just take and then change and then utilize. And so there's so much out there, but sometimes because we don't look, we don't necessarily know that it's actually there. Yeah.
We should look for it and show them. I will be, if I had a university and I were able to train my students, I will only go for free resources. I will force my teachers to go to get free resources and teach based on free resources.
Yeah.
Of course, any kind of free resources, but accredited free resources. Because I think I'll be a better supply chain expert if well, okay, let's put it this way. In Benin, most of the universities will teach you port supply chain management or marine supply chain management. None or almost none of them will teach you something about health supply chain management or any other sector of supply chain management.
Yeah.
So what's the point of spending 4 years or 5 years at universities learning how to move one container? I don't see the point. So for me, it will be more like first year, second year, you have to eat all the free resources you have online and you get all the certificates. It can be 60, I don't care. You just get them all. That gives you a good sense of what is being expected of you. Like if you go into the cold supply chain, you know how to handle vaccines. There are pretty small tricks that you might not know, but at least if you go for an interview test, it's not gonna be like, because usually how they see it is more like, I don't know anything about it, but I am a really, really hard worker. So I'm pretty sure if you show me, I will do it.
Mm-hmm.
So it's a different position than being like, I know exactly what it is. I might not know for a really specific type of vaccines, but for 60% of it, I know what you expected of me. And this is the proof, this is my certificate. And the other thing that is good about certificate is when you've done them, when the course is updated, most of them, you get an email telling you that, oh, you have a new version.
Yeah.
So you can actually go back and update, you know. So if we can do that, I am pretty sure, I'm not even talking about just my field, any kind of field. If the universities can just have fun doing that,
Yeah.
I'm pretty sure they'll be amazed with the results. We don't use free resources enough, but again, when it's free, nobody cares.
True. True.
Yeah.
Very true. All right.
When you
Thanks a
have to
lot.
pay
Yeah.
like 5,000 for your degree, then you think it's valuable.
Mm-hmm. Yeah, it's always the case. When you have to pay for something, you feel like you have to go because you need to utilize the money that you shelled out. But when it's free, you start thinking, okay, I have this other thing to do. Maybe I can go and do it, and then later on try to catch up. A problem with time is it never comes back. Once it's gone, it's gone.
Exactly.
Yeah. All right, so thanks a lot for spending the time here with us today to enlighten us a little bit more about supply chain management and what it is. And I think those who watch this will get a better idea of how they could apply this to the various areas in which they work within healthcare. So thanks a lot for this.
Well, it's my pleasure. And I think I'll come back for another podcast with blockchain supply chain.
We will be waiting for that.
Okay.
All right, so lab experts, thanks a lot for watching this episode today. Like you've seen, it's important to really watch what is being done online by lots of different organizations that are within your field. And then in general, you can find enough information to be able to continually improve on what you learned when you were in university. So instead of always looking and thinking that what is behind the paywall is the best, you should start with what you can actually afford. And I think we can all afford free. So free resources on the internet are extremely important. Try and get to those, try and learn as much as you can from those, get better. And as you get better, you'll make more money. And as you make more money, you'll be able to actually pay for all of those paid resources that you might also want to get access to. So thanks a lot and see you next time.
Thank you.